Hello, and welcome to another episode of MCREG International on the Go. I'm pleased to be joined by Dr. Gregory Furman. This is an area that's incredibly important for emergency physicians, and it's becoming more and more important as time has gone on as it relates to more patients being anticoagulated. Well, we have to step back a little bit, and I wanted to ask Greg, what are the indications for anticoagulation therapy for patients that not just come to the ED, but typically patients that might present to the ED with abnormal bleeding?
You bet, Brian. So atrial fibrillation is the most common indication that we're going to see folks in the emergency department. The average age of those patient population is going to be about 78, so quite a bit older than the patient population of, for instance, DVT and PE, which we see not infrequently as well. Emergency physicians are likely to start anticoagulation on the DVT PE patients, but actually see more of the bleeding complications in those that are on it for atrial fibrillation indications.
Well, you know, it's interesting that you mentioned that, particularly for atrial fibrillation. As your population is aging, this has become a larger problem for physicians and obviously the patients that they care for in the emergency setting.
Without question, Brian. So atrial fibrillation, we know that introduction of oral anticoagulation will reduce the stroke risk over a year about 60% over somebody that's not anticoagulated. But also it introduces possibility of bleeding. Now, bleeding can take a lot of different forms, which we'll talk about in subsequent segments. But emergency physicians will see this not infrequently in their day-to-day practice.
You talked about the age ranges on these patients, and we will be talking, it sounds like, about older patients, primarily with both patients that are being anticoagulated, but also with bleeding. And it turns out that those patients are at higher risk for bleeding, right?
Without question. So what we know, the indication for oral anticoagulation, atrial fibrillation, is determined by the CHA2DS2-VASc score. So the CHA2DS2-VASc score is a multi-point scoring system such that if you're equal to or greater than 2, you should be anticoagulated for stroke prophylaxis. It also turns out the CHA2DS2-VASc score is actually a pretty good indicator of your bleeding risk as well, such that the higher your CHA2DS2-VASc score is, the more likely you are to have bleeding. Throughout the spectrum, however, the bleeding risk is going to be much less than the mortality risk from an ischemic stroke over an annual basis.
I think this is what makes it so important for emergency physicians, because these are the patients that you deal with, particularly if they come in and they're anticoagulated and they have severe bleeding. This is something that how the emergency physician responds early on and in collaboration with other services will determine whether or not these patients will survive oftentimes.
Yes, this is a team approach. The approach to a bleeding complication in an emergency department patient is largely emergency physicians, but also you're going to have endoscopists from the GI services, you're going to have surgeons. All these folks are important to the management of acute bleeding.
Excellent, excellent. And you have to include nursing as part of this as well, because an important part of what we're trying to do is make sure that for emergency nurses, critical care nurses, and also advanced practice providers, that this is effective educational information for those caregivers as well.
In addition to that, APP, so advanced practice providers as well, will encounter these folks relatively frequently, whether or not they're nurse practitioners or physician assistants.
Well, as you can hear, this is something that, from emergency medicine's perspective, the population is increasing in age. They're more likely to develop atrial fibrillation and, in some cases, DVT, PE. This is something that emergency physicians will find critically important to understand who needs anticoagulation, who is currently on anticoagulation should they come in bleeding, and ultimately how to provide better care for these patients in the emergency setting and as they go through the hospital into the critical care setting as well. Thank you very much for watching MCREG International on the Go.